Yeah. But let's get into today's conversation. We've got a very important one. Kelly, this is not your first time here, but just remind the audience, tell them a bit about your background and what it is that you do.
Sure. So I am a social worker by trade. I did all of my training in Canada and then came back to Bermuda and started working with the Department of Child and Family Services, which was a really great experience. And then went into MWI, where I was there for about 8 years, working in the acute mental health team, and then moved over and started and implemented the first Bermuda Mental Health Treatment Corps program. While doing that, recognizing there was a space needed for mental health that people that the community needed, and while supporting a family member of mine going through the MWI kind of acute mental health service, recognizing there was a space that they didn't belong in, and kind of that as they were being discharged was handed a list of psychologists in the community and said, good luck. And having been the social worker on that team for some time, I was like, well, this isn't the support that actually this person needs, and we need to figure out how do we get that person that support. So spoke to my business partner, Dr. Eloise Pittscrick, and that conversation, after she accepted to take on this family member of mine, we talked about what would mental health look like in Bermuda. What when someone walks through the doors of a mental health setting, what can that look like and feel like? And we both agreed that it should feel like almost like a spa. You get treated like a spa. There's no stigma around coming in. You're being welcomed. There's drinks, there's food, nourishing the person, not knowing while you're sitting in the room. So that's how Solstice was started. That's my background. I did a lot of work within the homeless, mental health and addiction areas in Canada prior to coming back to Bermuda. And so my passion really has always been with mental health.
One of the things I like about what you shared with us previously and what I've read and seeing your post on social media and your website is that Solstice takes a holistic approach. And we've seen this word thrown around by politicians in terms of how they're going to address, the roads or crime and the like. But just explain to the audience the difference between a general approach to mental health versus a holistic approach to mental health.
Yeah, so we know that just the holistic approach is combining traditional kind of therapies with different models of care. So not just that one-on-one talking therapy, but also incorporating maybe, the medical side, there's medication sides, there's the talking, but also recognizing that there's things like yoga that science has proven really helps with mental health. We have experiential therapies. So we're really enjoying offering surf therapy with our children at the moment, and hoping to put that into the adult service. And then this year, we're really focusing in on the nutrition bit of mental health. So really looking at a person as a whole, not just sitting and talking about mental health, but recognizing there's a lot of research that's come out now around gut health and that's impact on mental health. And so we do have a nutritionist who's joined our team, Nurse Douglas, who will be speaking at our open house on the 26th. And really being able to manage both someone's body and their mind, recognizing that you can't have one without the other. You can't have good mental health, with bad physical health, and you can't have bad physical health with good mental health. It really just, one comes with the other.
I just want to go a bit deeper in terms of, you mentioned nutrition being so important. And I know I've heard people say over the years that they what's it called when they tend to eat, like, it's a thing where they're saying, oh, I eat when I'm depressed, or
they overeat or they binge eat
and guilt eat. Like, is this a part of what you're talking about, or is it just someone who, they just don't exercise? Can you go a bit deeper on this? Because I had never made that connection between physical health and mental health.
Yeah, absolutely. I think one of the talks that we're offering on Wednesday as well is around distress intolerance, which Dr. Shawnee Baisden's going to be talking about. And that's, we all deal with stress every day, some bigger stressors than others, but we all deal with stress. So how is it we deal with stress? And those behaviors of how we deal with it, whether it's eating, shopping, drinking, drugging, over-exercising. There's so many things that we do to our bodies that it's the way that we've been coping. And a lot of times we don't even know we're doing these behaviors until we stop and really think about them and take care of ourselves. So there's overeating and undereating, and just being able to figure out why, and what are the behaviors that are impacting my mental health, my ability to function both at work, within my family, my day-to-day, what's working for me, what's not working for me, and really making that connection between our bodies and our minds.
Wow. Kelly, that was really clarifying for me, because I love that you talked about like over exercising and then not exercising, because it shows that even something that can be perceived as a good thing, when you use it for the wrong purposes or overuse it, it can have a negative benefit. So I really love that. Solstice is celebrating 10 years of care in Bermuda. How has the mental health landscape in Bermuda, or perceptions of it, changed since this time?
I think we've come a long way. COVID helped do a lot of things, helped get the conversation going, helped to put mental health in the conversations with our young people, with our companies. So now, a lot of companies are saying, we have this kind of, we have health insurance, but our health insurance doesn't cover a lot of mental health care. So we're going to actually have an employee assistance program within a mental health service. So we've been seeing kind of an increase in companies uptaking our EAP service. Dan Kavanaugh, I think he's been on here before, did the adolescent mental health research. And that is an amazing piece of research that Bermuda owns and is being kind of sought after around the world. So he has done an amazing job and has had a team of collaborators between the Bermuda College, Warwick Academy, the Department of Health, Ministry of Health, us, Family Center, BHB. So we're all coming together, which is not something that necessarily happened years ago. And we're taking his research and we're actually applying the outcomes of his research to say, okay, you know what, the youth spoke to us. We were able to speak to, I think it was 2,700 middle and high school students. They told us that their literacy around mental health isn't great. We know that adolescent mental health and anxiety, depression, anxiety is higher than the rest, in the higher category in the world. We need to do some work there. We know that they go to their friends first before they want to go to their families, their parents first, but the families also don't necessarily know how to talk about mental health. So kids are talking about it. And so what we've, learned is that we have to incorporate different kinds of therapies from that, like the surf therapy that we're doing, our art therapy, animal assisted therapy, things that people don't, the traditions of mental health, sitting in a room with someone isn't necessarily always going to be the right fit. One of the big things that happened over time is prior to COVID, we didn't have telehealth accessible through insurance. And so when COVID came, we basically our business stopped. We didn't know how we were going to pay people. People didn't know how they were going to afford their private mental health care. We knew that there was going to be this tsunami of something, but we didn't know what at the time. So we spent days and hours and nights trying to advocate with the Bermuda Health Council to get telehealth insured so that people could get their mental health care. And so one of the positive things that came out of that was that all but one insurance company on the island has continued with telehealth, which has made a really big impact on accessibility for mental health around if you're at work or if you're a student, a Bermudian student who's away at school, but you already have a relationship with your therapist, you can continue that relationship, which is such a key part of mental health care. you might be at home sick, but you still really need that appointment. So you can do it from home. And if the clinician's away because they've got to go away for whatever reason, they still can see that. So things have evolved. Our relationships in the community have evolved. We're working much closer with all of our community partners. There's a lot of work out there. There's still a lot of work to be done. There's still a lot of destigmatizing we need to do around mental health. There's certain communities, there's older populations that just want you to get on with it and suck it up. So a lot of times we have people who come in the door and they'll sit down, in a room with me and they'll say, I don't know why I'm here. Somebody told me that I should come here. I kind of am dealing with this, but I don't really know how this thing works, counseling or therapy. And by the time they get out, they get up to leave, they're just like, you just hear that sigh of relief and they say, "Whew, I should have been here years ago." And so I think we're impacting people over time. And people aren't necessarily going back to their office and saying, I just came from therapy. That was great. Young people are. So young people, it's cool to have a therapist now. So,
When I was in primary school, they would ask like, "Oh, why do you come school late sometimes?" And I'm like, none of your business. That's how I was when I was a child. But
because those years you would have been called many things by everybody.
Now I can, like, as a Gen Zer myself, like, therapy definitely is cool or normalized. Sometimes relationships can feel like proxy wars between therapists because, like, you're like, oh, my therapist said this, my therapist said that. So you're definitely right. And you spoke about this a little bit in your early response. But can you tell us who is the ideal client for the services and workshops that Solstice offers, or whether it's a kind of tailored approach?
Yeah, so Solstice, we see the whole lifespan. So we see children as young as 2 all the way through the lifespan. And one of the things we are launching this week is our longevity center, which is looking at kind of the long span of good brain health. And how do we assist making sure our brain health is long? We know there's a lot of talk about dementia and Alzheimer's, and how do we kind of assess where we are at now? What are the things we can do to slow down the process of Alzheimer's and dementia if we can, if we know it's in our family? We can do assessments. So the Solstice is open for everyone, individuals, couples, families, students. We will see every age group. The workshops that we're offering this Wednesday from 12 to 4 are geared towards the general public. Our open house is going to be from 12 till 2, and the workshops are 12 to 4. You need to sign up on our website about those. We are almost full in a couple of the workshops, but the idea is to get people in the door. This is our 3rd time moving. We've been on our current location for the last year. Hopefully we're not moving again. The idea is to get people to come through the door. And if you've been contemplating or you want to know, what is Solstice? What does it look like? What does it feel like? Who are those people in there? I've heard this, or I don't know. And the idea is to get people to come in the door, feel the environment, look at the space, talk to the staff, the clinicians, and then say, you know what, that does feel like a comfortable space. I did connect with a clinician who does work on couples counseling or individual therapy or this kind of issue. And then hopefully that will get people to feel a lot more comfortable about making that phone call and saying, I'd really like to come in and meet that. I felt comfortable. I felt my information was going to be confidential. And then so those workshops are open to anyone as well.
I love that. What are some things that you have coming up at Solstice that may be of interest to those who are seeking your services?
Well, we have on Wednesday, obviously, we have our open house, which is the beginning of our 10-year anniversary. So the open house is 12 to 2. And then our workshops are from 12 to 4. We also have a women's hormone health group that we have one is full, but we've opened up for another group. And that is one of the, very popular topic these days is hormones and menopause, perimenopause for women, and recognizing there's not a lot of support out there to get answers, to connect with peers, to get good sound guidance on hormone balance, medications, eating. So that group's coming up. Other things that we have a really popular and great children's program that we've had since our 9th year. We started with Lego Club. We now have on Saturdays have a really great children's program, which is around groups of good fit. So we talk to parents and see the child and say, what are some of the challenges you're seeing in the school and how can we support those? And so someone might come in and say, well, they don't, we're working on this, we're being challenged with this. So we put them in groups of good fit, and we have clinicians working in these groups on Saturdays. Prior to COVID, we were at about 60 to 80 children every Saturday. We're just starting to get back up to that kind of between that 40 and 60 range where we're seeing children, and it's making. So those programs are going on. We have camps during the camp holidays, the summer holidays. And one of the things we start in April is our surf club. And so that's a lot of research is coming out around using surf therapy with children. And so we've had a few of those groups. And so we'll be starting that next in April.
Karen Simmons asking, does Solstice have a crisis helpline, especially for young people?
That's a great question. We don't have one, but what's come out of Dan's research is that this is needed. And so I can say that I was in a meeting last week with our community partners who are all working very hard and trying to get that launched before the summer.
Mark Arthur C. Phillips asking, why do we have some insurance companies that don't recognize some therapy practices? Let's go a bit deeper on this. What does it look like? Because one of the concerns previously was that mental health isn't covered by insurance. Where are we at with all of that?
I wouldn't say things have gotten much better. Definitely every insurance company covers mental health differently. That's why our intake process is quite, we talk about when someone calls and they want an appointment, they'll call and talk to one of our therapists for a free intake appointment. They'll tell us what insurance they have. We will give them the cost of the session, what the insurance will pay and what the copay will be. This is something we always advocate that people go back to their insurance companies and advocate for. There are certain insurance companies that do better than others. Mental health isn't just a one appointment fix. It's a process. You have to be able to trust that person. If there's trauma, the trauma work takes grounding. Then you can go in for some of the work, but you also have to be on the other side of that work to be able to make sure people are coping well with having gone through that trauma. So, covering 6 appointments on your insurance policy isn't going to be very helpful to get into a lot of that work. So a lot of the times we come back and ask our clients who complain to us about the insurance coverage to go back to their insurance companies and inquire why mental health isn't covered similarly to physical health. So that's it. And there's, unfortunately, I think GHI is one of the ones that we get challenged by because the coverage for the GHI is quite low and they don't cover telehealth.
And GHI is government health insurance plan? Okay. No, I heard people say that. I didn't exactly know, but in saying that and addressing this, and not to get too political, but do we need legislative change to address the way that mental health is treated as far as being covered by insurance?
I'm not sure about legislative change. I think it's going to be up to the insurance companies to review the coverage that they provide for mental health and find out and, look at that and evaluate it and say, okay, we cover this much for physical health. Why are we not covering the same amount for mental health? Physical and mental health should be treated equally. Like I said earlier, if we don't have our mental health. We don't have an overall health.
Mhm.
And so we really, I believe we need to really be focusing on treating the mental health, because with good mental health, as if people can access that, they're going to be better employers, they're going to be better family members, they're going to be better community members. We're going to prevent kind of generational mental health trauma. And so there's such a huge need to invest in mental health, and the coverage and getting it accessible. As a private company, we get a lot of pressure from people in the community because we provide mental health, and there's almost this, we often get like, well, can't you see them for free? And why is there so much money? Why is it expensive? And so I would say, we don't get coverage like physical health. We also have, within Solstice, we have a training program for Bermudians. A lot of the, at the hospital and in government, it can be quite difficult to get into certain areas to be able to get training hours to get accepted into competitive training programs. And so when we started Solstice 10 years ago, Eloise and I were very committed to making sure that Solstice was a place that Bermudians could come, knock on the door and say, I really want to get my master's or my PhD in psychology. I need this experience. I need these hours. Can I come and work here? And so that internship program has developed over time. We're so proud of this, this program. We have at least one person every year has gone into some kind of clinical training program of their choice. And so that's something we're excited about. But what's evolved out of that is we've ended up hiring staff that come at a cost, who might not be generating income, but they are contributing and they are getting employment, and then they're getting all that they need to go off to college, university, and hopefully come back one day and work in mental health in Bermuda, because we know there's a shortage of mental health workers. Just this year, we did have our first intern come back and start working at Solstice. So that is really nice to have a first, our full circle of having an intern 9 years ago. She went away, got training, got her experience, and has come back as a child therapist, a psychologist.
We've got a call. Otterbridge says, I'm a satisfied client of Solstice, and I'm happy to hear your show host mention Gen Z openly talks about seeing a mental health professional. I'm 58, 30 years ago, that would have been social deletion, especially in Black Bermuda. We've also got a question, Charles H. Jefferson II asking, are there any grants that provide opportunities for the uninsured or underinsured to receive treatment from Solstice or somewhere else?
So we do, I can talk from Solstice. We do have a low cost program. So if people call in and they say, I want to access your services, this is my situation, we do have a pathway for low cost services. In the community, obviously MWI is a great kind of free resource to our community, so you can walk in there or call for an appointment. I know the Women's Resource Center does offer some mental health treatment care for women. I would say we often do see a lot of clients who their insurance maxes out, and so we don't. And we do a lot of pro bono that way. We also have in our groups program, we do see quite a few kids without charging any. That's where we can invest the most into our community, and then getting out into the community and doing some community work in terms of low cost. So we have low cost. We do see some kids for free. There are limited, and we are challenged as a community in mental health being able to access it for that non-urgent care treatment that people really need. So on our website, which is solstice.bm, it talks about everything that we can do, everything that's coming up. You can sign up for our workshop. So on this Wednesday, we are really inviting and thanking the community for your support, and we hope you'll come in and talk to us. That will be from 12 to 2. There's 2 entrances because we've got 2 separate buildings. We've got our adult kind of center, which is on 18 Parliament Street across from Hamilton Pharmacy. And then we have Clovelly House, which is across from Sears or shopping center on Victoria Street. So there's 2 entrances. It's connected by one hallway. But there will be people at both entrances there. So that's 12 to 2. Come in, talk to our staff, see the environment, and yeah, have some coffee. We'll have some treats. And then between 12 and 4, all the workshops are there. So our first one is 12 o'clock, and that is going to be called Let's Talk About Sex. So that is our team of clinicians who do sex therapy, intimacy issues, couples counseling, divorce coaching, mediation. So that's kind of going to be talking about relationship issues. And then at 1 o'clock, which is almost full, it probably will be full this morning, breaking the cycle, addressing developmental trauma in children. We will rerun these workshops throughout the year, especially if they get full. So that's at 1, and that's Dr. McManus, who is our psychologist who's just returned to Bermuda, and that's with our child and adolescent team in our Growing Mind Center. At 2 o'clock, Dr. Shanae Baisden is going to talk about fake it till you make it. And it's going to be what I talked earlier about managing distress and tolerance. So how do we get through life managing our stress, because we're all going to have it in a more positive way than a negative way. And then at 3 o'clock, we have two workshops going on. One is around with our new nutrition program. And so we're launching that nutrition program. And that's what we were talking about earlier, like connecting that gut health and our physical health with our mental health. So you'll get some good tips on that. That one's almost full as well. And then we also are launching our longevity center. So that is, again, about that older, aging gracefully and with good brain health. So we know that we need to be really focusing on our brain health right now, and also the caregivers of people who are supporting those who might be aging or experiencing symptoms of dementia and Alzheimer's.